Hello, my name is Wendy McCracken and I'm a Professor of Deaf Education at the University of Manchester. Welcome to the first week of Deafness in the 21st Century. We hope you will find this exciting, intriguing and informative. How we see deafness in the 21st century is dependent on our beliefs, experiences and expectations. A wise person noted, "The future is here, it's just not evenly distributed." This MOOC will share the expertise of many who work in low and middle income countries, as individuals, as part of healthcare provision, within an NGO, as a deaf role model, a deaf professional, or parent of a deaf child. Progress will be made when all interested parties work together to raise the profile of this underrepresented and vulnerable group of children and adults. Governments see deafness as a low priority, but without service provision, deafness undermines educational and vocational attainment and leads to stigmatisation and social isolation. Dr. Devet Svanopol, University of Pretoria and Dallas, challenges to all to look at the world differently. So here's our usual view of the world. Look at your own setting and how it changes in the coming slides. I'm grateful for him for allowing us to share his slides. Look carefully and note that if we consider population growth, we can see that the largest growth is in low and middle income countries. Consider that 97 of every 100 persons added to that total is from a developing country. It is the low and middle income countries where infant mortality is highest, 10 to 20 times higher than in high income countries. In a study of the global burden of disease, the World Health Organization identified that deafness, mild to profound, was the most prevalent disabling condition globally. The World Health Organization 2012 considered per capita income spent on healthcare. This illustrates not only the massive disparity, but the level of challenge faced in resource-poor countries. The challenges are complex as deafness has been termed a silent epidemic. Widespread, not detected, not life-threatening, but with lifelong implications. The Human Poverty Index is an indication of the standard of living in a country developed by the United Nations to complement the Human Development Index, and was first reported as part of the Human Development Report in 1997. HPI-1 for developing countries has three components. The first element is longevity, which is defined as the probability of not surviving to the age of 40. The second element is knowledge, which is assessed by looking at the adult literacy rate. The third element is to have a decent standard of living. Failure to achieve this is identified by the percentage of the population not using an improved water source and the percentage of children underweight for their age. As a region of the world, sub-Saharan Africa has the highest level of poverty as a proportion of the total population at over 60%. There is clear evidence that newborn hearing screening programs offer the opportunity to identify permanent hearing loss early. Early identification, where followed with the provision of hearing aids and early intervention services, are linked to improved outcomes in communication, literacy and academic performance. In low and middle income countries, identification of hearing loss is delayed. Research suggests that in sub-Saharan Africa, deaf children are generally identified after they've reached their third birthday. In Angola, identification is commonly delayed until the age of 6 years, and in Kenya, 5.5 years. A study by Olusanya illustrated that in an urban setting in Nigeria, parents had suspicion of deafness as early as 12 to 24 months. The early identification of deafness is strongly linked to the provision of amplification in high-income countries, where, for example, in the United Kingdom, hearing aids are provided free as early intervention services. It is now easy to see that it's the countries that implement newborn hearing screening programs and are able to provide early access to intervention services and amplification also have the highest number of children who use spoken communication. Whilst many countries now have a hearing screening programme, far fewer identify children with hearing loss before their 3rd birthday. It is the children who are identified before 3 who also receive hearing aids, allowing them to access spoken language. The outlook for those later identified is less favourable and has lifelong implications. Access to spoken language is particularly important if you want to be literate. The words on the page are spoken language in the form of script. Hearing the words of your family, village and community allow a child to feel connected and part of society. It is not surprising that we see the maps where we have early identification, early use of hearing aids and early intervention services are also the ones where literacy is achieved. When provided with appropriate access to services, deaf children grow into adults that contribute to society by entering employment and are self-sufficient. The World Health Organization note that improved life expectancy also means early onset hearing loss has significant implications for long-term economic cost to individuals, families, communities and countries. Adult onset hearing loss ranks 3rd globally as a cause of years lived with disability. Such disability is linked to stigmatisation and isolation, with adults facing ignorance and lacking access to appropriate services.